Everyone. My name is Malinda Ashcraft. I'm a bachelor's prepared registered nurse. I've been a nurse for 7 years now. My background includes med-surg, inpatient oncology, a little bit of case management through an insurance company, as well as inpatient hospice nurse experience. And I've now been in hospice for about 3.5 years. Currently, I am studying to get my Master's of Science in Nursing with a focus on education. And today I'm going to be talking to you about high fidelity simulators. So before we can really talk about high fidelity simulators, we need to go over a couple of very important definitions, just so we can better understand what everything means. So a simulation, in its easiest terms, is defined as imitations of real life events or circumstances. So this is when there is a scenario that students or those working in the healthcare field will go through and complete, and it's very similar to something real life that would occur when they're caring for someone. A simulator is a mechanical or electrical device that provides an environment in which a simulation can occur. So oftentimes we think of the simulator as the mannequin. There are also simulator labs. So that's the laboratory where nursing students, medical students, other healthcare professionals will go and train and learn in a very controlled environment. And then there's also the definition of fidelity. So fidelity refers to how closely a simulation imitates reality. So there are different kinds of fidelity, but really when we're thinking about it, it's how close that scenario that the students or healthcare professionals are completing and how similar that scenario is to reality. So when they actually care for real live patients. So understanding high fidelity simulations requires that we understand the different types of simulations. And there are 3 main categories of simulations that go with fidelity. So low fidelity simulations are ones that feel the least real to the learner. These are the types of simulations that we often think about for first-year nursing students. It's more task-oriented type simulations. It's, mannequin arms that we're practicing IV insertion on, mannequin arms that nursing students and med students are practicing how to place a blood pressure cuff, that sort of thing. So it's not something that's really going to seem real in the sense that it's human-like, but it is an arm with veins that are able to be seen. And it's really practicing the motion and the skill of inserting an IV. Then we have mid-fidelity simulation, or middle. These are more realistic type of simulations. They allow for more learning opportunities. These are the simulations we start to see students partake in as they advance through their nursing schooling. So these are the types of simulations where a full body mannequin is used. And students are able to practice listening to breath sounds and bowel sounds, that sort of thing. They're able to hear those types of sounds sometimes, depending on the type of simulator. But it also kind of is similar to low fidelity simulation in the sense that, you're practicing how you're going to do things. So you're practicing, where am I going to listen anatomically on the simulator or on the mannequin to listen to breath sounds, to listen to heart tones. It's learning the placement of your stethoscope, and it's gives students an opportunity to have a mannequin lying in the bed that has the anatomical features that a human would have, and allows them to practice those skills. So Foley catheter insertion, putting in an NG, those type of things. Then there are high fidelity simulations, and these are the most realistic type of simulations. There's a lot of interaction going on, and it really just means these are the simulators, the mannequins that are able to talk to the students. So a lot of times, when I think back to my nursing schooling, we used a lot of low fidelity and mid fidelity simulations when it came to practicing in the lab. So we had the opportunity to go into the lab during open hours, practice all these skills so that when we were in our actual class, our professor would then set up a scenario simulation, and it would be high fidelity where we would go in and that mannequin would actually be able to talk to us. And so these are the most realistic because, the professor is able to talk through the mannequin, or there are special softwares that allow for the mannequin to talk with the students who are practicing. And that is the most real because patients aren't going to just be laying in the bed and be perfect and be still, but instead this is allowing students to really understand what it's like when a patient is talking to you and they're having symptoms and, they're having pain and they're telling us they're having pain, that sort of thing. So it allows a more realistic interaction between the nursing student, the med student, or even healthcare professionals who are just practicing in a simulation lab. Helps them to have that realistic interaction. So simulations actually have a long history, and it's very interesting. The first anatomical models were invented in the mid to late 1800s. These were invented during the Civil War, as a lot of, especially women, were working to help care for the soldiers. They were learning all these things. And so these first anatomical models came, and these will be what we consider low fidelity today. These are, mannequin arms that they were able to practice how to bandage people up, how to start an IV, also help them to understand how to bathe patients, that sort of thing. So they were able to kind of focus on those psychomotor skills. And then in 1911, the first mannequin doll was created, and her name was Mrs. Chase. And this allowed for nursing students and med students to practice the fundamental skills on an adult size doll. So it would be similar to what we think about when we see our mannequins lying in the beds today. Interestingly, though, they were much smaller than the typical patient is, especially today, and couldn't do obviously as much as we can now, but they did allow for that practice for students to practice on them and learn those types of fundamental skills. And then eventually a baby chase was actually created, a baby chase doll. And then obstetrics nurses and medical students were able to practice with that. Between the 1920s and 1930s, nursing art laboratories were created. So these were places that were specifically built for nurses at the nursing schools, at the universities, the colleges. And it was what we think of as the lab today, where students can go in, practice in a safe environment. They have the different dolls or mannequins that they can practice on. And so that is when that started. And then it also provided the students with equipment. So there was practice equipment, practice IV supplies, different things that they would have been using, and they could practice on the mannequins, but they could also practice on each other. This is kind of what really started. For a long time, this is the only thing that schools of nursing had, was these laboratories where students could go and practice. But then in 1946, the Hill-Burton Act was passed. Now, this is post-World War II period. It became very clear during World War II with the prevalence of obviously wounded soldiers, and then there was infection and diseases. It became very known that there was going to need to be a lot more competency and experience among the nurses who were going to be caring for patients. There's a difference between that battlefield caring for someone when you're just trying to help someone survive, and then we, start learning about different chronic diseases and such, and there's a need for these nurses who are coming in to be more experienced. And so what's interesting here is, prior to this time, nursing students would do diploma type nursing. They would go to a hospital. That's where they really learned. They had hands-on experience right away. Well, with the Hill-Burton Act, it actually required that BSN programs had a 6-month preclinical experience, meaning before the students could even put their hands on a real live patient or even shadow a nurse, they were going to be practicing in the nursing art laboratories and learning the skills they needed so that they could be more experienced when they actually took care of patients. So this was really important. In the late 1960s, the first computerized mannequin, Sim1, was created, which was really exciting. As you can imagine, the technology at that time was not where it's at today. And so there was a lot of expenses with this mannequin, and a lot of nursing schools, universities, colleges could not afford to get one of these mannequins. So unfortunately, even though it was a very exciting time, a lot of schools could not get their hands on them. And interestingly, the first mannequin, the Sim1, was actually created at the University of Southern California. So then, other schools were seeing this and they're like, man, we really want that, but it needs to be more affordable. And so actually a more affordable option came into being around 1968. And it was a lifelike simulator called Harvey. And many nursing schools around the country started using Harvey. Skip ahead some time. In the 1990s, we started seeing an increased use of low and mid fidelity simulators, especially in nursing schools. It was proven that students practicing on these mannequins in the nursing art laboratories really helped to increase student confidence and their ability to really retain what they were doing, because students would go to these labs and they would just repeatedly do these skills over and over. And so there was increased confidence that they would be able to do them when they actually cared for patients. So by 2001, the first fully automated lifelike SimMan was created. And obviously it has just advanced from there. But this was the type of simulators we're seeing today. And these are the ones, the mannequins that, are the full body anatomical structure that students can learn from. And then obviously as technology advances, we're seeing much more lifelike SimMans, and, that can have symptoms and, can talk to us and have that interaction that we're seeing. And so it really wasn't until we had that SimMan that we were able to start creating and utilizing high fidelity simulations. So reviewing the literature, there has been a lot of studies completed on the importance of high fidelity simulations and why they are so important, and really to kind of prove that these are going to increase confidence, increase competency, increase knowledge. So I kind of narrowed it down to some really interesting studies and reviews that I found. And one of them by Zatko et al. Back in 2018, they completed a 2-year study evaluating self-confidence and student satisfaction with high fidelity simulations. So through this, they were able to study students over a 2-year period. So first it was students at the beginning of their nursing, and then as they were advancing. And what they found was, in those first year of simulations, especially at the beginning, students, didn't know what to do. They didn't know what to say. They would need much more prompting from their professors and teachers. But as they moved on through the program and continued completing more simulations, their knowledge grew, and they were able to have some more self-confidence and autonomy in completing these simulations. So with repeated exposure, students were more satisfied and felt that they really were learning. And it's the same idea of going to that nursing laboratory and practicing a skill over and over. When you're completing simulations frequently, that confidence level grows, which is then going to run over to when they go to clinicals and then when they're practicing as nurses on their own. Stelflug and Lowe completed a study in 2018 where they actually studied PALS participants. So it's not very specific if it was just nurses, but you know, it's people who are already licensed. So, you know, nurses, physicians, even respiratory therapists could have been a part of this. And they studied them over a 6-month period to test knowledge retention when high fidelity simulators were used. And what they found was they had a group that participated in a high fidelity simulation. So, you know, when they would have to get their certification, the participants could either just do the, you know, online or the book reading, or they could actually participate in a face-to-face simulation with a mannequin. And what they found was that those who participated in that, their knowledge and retention was much higher than those who just did the typical renewal, which is interesting because obviously having your PALS certification is a big deal. And it's very important that those who get that are, you know, retaining that knowledge and able to use those skills. So what the researchers found was that there was just improved knowledge as well as self-efficacy over time by those who participated, and they encouraged that more healthcare professionals do high fidelity simulators when they're renewing their license or their certification for PALS. Tyler et al. In 2019 actually just did a literature review of 9 different past studies that utilize simulation to educate on comorbidities. And what they found was their focus for this was really on mental health comorbidities. So helping, you know, their focus was trying to figure out if simulations could help better understand not just the physical side of a patient, but those mental health conditions, those emotional conditions, that sort of thing. And so what they found was those simulations, the knowledge increased significantly among those who completed high fidelity type simulations versus like a low or mid fidelity. So what they were trying to say was, you know, it's important to include simulations that are focused on comorbidities such as mental health and not just the physical conditions we see, but focusing on these others as there is increased knowledge and patients need those needs needed. Sean and Abbott in 2017 created an end-of-life high-fidelity simulation. This is one that is very interesting to me as I am a hospice nurse, and I find end-of-life stuff very interesting. And in this simulation, they were able to use a high-fidelity simulator mannequin to create end-of-life symptoms. So things such as terminal secretions, they were able to actually have the simulator show modeling, that sort of thing. And so it allowed the students to really learn about and participate in care at end of life and recognize that sometimes we're not going to be fixing the problem anymore. We're going to manage the symptoms. And there's a lot of, you know, negativity, almost feeling scared when it comes to taking care of patients who are dying because we're so focused on saving patients. But what do we do when we can't save them anymore? And so there's so much value in end-of-life simulations for students to learn how to talk to the patient, how to talk to the family, and how to manage the symptoms of secretions and restlessness and pain, and how it is different than in a normal situation where the patient isn't dying and we're treating a disease. And so they were able to have students go from feeling pretty afraid and not having confidence in caring for someone who is dying to, after this simulation, the students expressed increased confidence level. They were able to see things that they never saw during their clinical rotations, as many students don't even come across a dying patient during their time in clinical. And the nice thing that many of the students voiced about this type of simulation is that because they were able to do this in a safe environment, it really made them feel like, okay, I can do this when someone's actually dying. And it helped them to discuss the things that need to be said and learn from each other on what works and what doesn't at the end of life. The last study I found was also very similar to an end-of-life simulation, but it focused on ethical and legal issues that oftentimes we kind of skim over in our nursing schooling. And this was done by Smith et al. And what they did was they utilized a high-fidelity human simulation to teach on ethical and legal issues. So far when I've been talking about the high-fidelity simulators, I've been talking about mannequins. But in this simulation, they actually used an actor who was able to act as the patient. So instead of having a sim or a mannequin in the bed, it was an actual person who had a script, knew what they were going to say as the patient. And so the interesting thing about this research study was the reason it was completed was because a lot of these professors who teach the core classes, like the pre-nursing classes, the general education classes in these universities, felt that nursing students were kind of just brushing those courses off and not necessarily putting in the time that they needed to put in because they felt, well, it's not really important. It's not one of my clinical courses. I'm not going to go to clinical for this. You know, it's not really nursing. But these professors who taught an ethics course really wanted to help the students realize that there is a lot of good they can get out of an ethics course that goes along with their nursing care, their medical care. And so they actually created a simulation so that students could understand the ethical and legal side of healthcare. And what they did was, it was a simulation where the patient or the actor was only in his early 40s, you know, he was dying, but there was never a DNRCC sign. There was never an advance directives created. And the patient was to a point where he could not make his wishes and needs known. And the interesting thing was, the students were just so focused on taking care of the patient physical needs, but not those other needs that the patient had. And so what was interesting was, they had in the scenario that the patient goes into asystole. So obviously right away, all the students are like, oh, we have to do CPR, we have to do this. But then there was another student or actor playing the patient's wife, and they were told that they needed to stand up and say, he doesn't want CPR, he would never want this, don't do this. Well, as that's occurring, we then have the patient's children, or the actors, the students who have been prompted to stand up and say, no, you have to do CPR, you have to save my dad. And here we are at this ethical issue of, what do we do? Well, it really helped the students to understand that these are questions we need to be asking patients long before they are in their final moments of life. And so it was a very interesting simulation, and it helped the students to realize that there are more important things, or things of just as much importance, I should say, then the physical side of nursing, and it's understanding these, and obviously there's much more that goes along with this, understanding how to interact with the patient's family members who are obviously fighting, and that communication. And so this is a great simulation that allows students to learn in a safe environment on how they would react in these situations, because they do come up. So why is there a need for high fidelity simulators and simulations? Well, there's a need for it based off of the benefits. It's very clear that students can learn a great deal of information just by completing these simulations, by practicing and that repetition. And so one of the main things about high fidelity simulations is the optimum interaction. And so, as I mentioned before, these are simulators that can talk back to the patient or to the student. So they're able to have something that is very more realistic than just someone laying in the bed that you can manipulate to do everything you want. This time they're having someone talk back to them. So they're having that interaction, and then they're also communicating with their classmates of what to do. Another awesome benefit and why this is needed is the students are able to learn in a safe environment. And so there's no patient safety risk. You know, nursing is so much learning as you go, and it's hard to fully understand patient care until you've done it, to understand skills until you've done it. And though a mannequin can be very much lifelike, there are some limitations, obviously, but the great thing is that students can learn in a safe environment where there's no penalty per se when something goes wrong. And, you know, let's say it's a high crisis simulation and the patient codes and dies because the students weren't picking up on something. You know, it's a safe environment to learn. And it allows the students to watch each other, to give advice and say, hey, I really like how you did this, but maybe next time you should do that. And that helps develop critical thinking skills as the students are watching and interacting with each other. And then the professor can also provide that educational piece. So obviously as well, we're going to have increased confidence, knowledge, and critical thinking when the students are participating in high fidelity simulations. You know, as those studies showed, students did feel increased confidence in themselves. You know, they were able to see the scenario, practice the skills, you know, learn that communication piece before they actually go and do it in the clinical setting or in their first job as a nurse. And so that helps increase their confidence that they can do it. The nice thing about high fidelity simulators and simulations is it is an alternative for face-to-face interaction when clinical availability is low. Thinking back on the last year in COVID-19, a lot of students did not get to complete the typical clinical rotations that they normally would. So it was important that nursing schools and universities, colleges, and even medical schools and universities utilized, you know, high fidelity simulators so that students at least had some type of experience. Another great benefit for this is that it does cater to various learning preferences. So some students are seers, some students are doers, some students need to see it and then do it. And so there's great value in that hands-on experience. Because the thing about nursing is to really understand the skills. You know, you can read about a skill over and over in your textbook, but to really understand is to do. And so students are able to, you know, watch their classmates complete a simulation, complete a skill in that simulation, and then they're able to do it. And so that goes along with that idea of just repetition and repeating all those. And then another really great part of high fidelity simulations and why it is so needed is the ability to provide constructive feedback. So this means that the fellow classmates, the fellow coworkers, if this is occurring at, you know, a hospital healthcare professional setting, you know, those that are watching can provide constructive feedback, which I kind of touched on this, but it's the idea that, you know, they can say, hey, that worked really well. Or, I think maybe next time you should try this. And you'll see these light bulbs just kind of go off. And finally, you're able to take what you learned in lecture, what maybe you've seen before, and then the simulation, and piece it all together to better understand how it works and to better understand how you can provide the best care when you're dealing with a real human. And so it allows for that safe learning environment where your professor can say, hey, next time you need to do this, because if you do this in real life, the outcome's not going to be good. And so giving that constructive feedback and that ability to say, here's what you did good, now let's work on this, can be really important. So what I am personally proposing, and though this can be quite a high goal, but what I'm proposing is that all nursing programs in the United States start utilizing high fidelity simulators. So a requirement, whether that be through the state board, there's different regulating bodies. So my thoughts on it are, in order for the university, the nursing program to get accredited, they have to do this. So that would be one way to hold nursing schools accountable. What nursing schools can do is kind of take those core curriculum courses, the core nursing courses, and build scenarios throughout the program. So maybe in that first class, that first nursing class, you're just learning about how to talk to someone, how to address them. And so that can start there. And then as we're going through the program, so then next simulation, we're going to throw in a skill that you just learned, like a bed bath. And just building on these throughout the program till you're getting to a point where maybe it's a crisis simulation. And something interesting I thought of as a hospice nurse would be starting a simulation scenario that builds throughout the program that would start as someone who everyone knew was going to die, and they've signed their DNR, that sort of thing. And then by the senior year of that nursing program, they're doing a scenario where, hey, this patient is actively dying. What all do we need to do? And so you're building on that knowledge that you're going to use from that first scenario, that first simulation, and you can see that growth of knowledge occur. Part of requiring this could mean that you have to complete so many simulations each year to advance through the program or to advance to the next course. As some students might kind of shy away a little bit, encouraging students to, hey, I'm going to need you to do this so that you can keep going through. It's going to help students to increase their knowledge, increase their confidence. And then by the time they're seniors and completing those last simulations, you're going to see way more of that critical thinking going on. And then there's also the option of requiring that students complete a simulation to qualify for clinical rotations. So perhaps, before you're allowed to do a certain skill at clinical, you have to first complete the simulation on it. That can really encourage students to not just kind of be passive through a simulation, but to really hone in and learn those skills. I'm also proposing the required use of high fidelity simulators within hospitals in the United States. So that could go the same way. It could, as far as accreditation goes, when I think about accrediting companies, I think of like JCO. And so in order for that hospital to get their JCO renewal and accreditation, they have to show that they're using high fidelity simulators. So what I mean by this is some hospitals, especially teaching hospitals, do have simulator labs that medical students will use. And maybe that hospital also has their own school of nursing. So nursing students use those. But I'm thinking more like, let's use these simulators for all staff, for yearly competency, unit-specific training, because obviously someone who works on the oncology unit is going to have a little bit different competency skills that are going to need to be tested than someone who works on the orthopedic floor, that sort of thing. So making them kind of unit specific, but requiring that in order to keep your job, you're going to have to complete a yearly high fidelity simulation. So all that really is going to do is just help increase knowledge. It's going to ensure that your staff is competent, because as we know, there is further evidence-based research being done every single day on advancements on skills we've been doing for years, where, hey, if you do this, it's a better outcome. And so that, refresher, that can be very helpful. And to go along with that, it would be very interesting. And also, I think it would really push more nurses to participate in these simulations if their state nursing board would count that for some of their continuing education credits. So high fidelity simulations will improve a couple things. So the first thing that high fidelity simulations will improve is patient outcomes and satisfaction. So how is this going to occur? Well, with increased experience, so as the student nurse, the staff nurse, the student medical student, the medical doctor, the resident is getting increased experience through simulations, their confidence level is going to increase. As their confidence level increases, they're going to have better outcomes and higher satisfaction for patients. And what I mean by this is, with increased experience, not only comes increased confidence, but increased knowledge, so that they're able to provide high quality evidence-based care. And then the patient will have a higher satisfaction. High fidelity simulations will also improve access to care. What I mean by this is, as more nurses in particular have increased experience through simulations. So there are obviously a lot of skills that are very field specific to certain types of nursing that we don't really learn in nursing school. That's why high fidelity simulations should be utilized everywhere in hospitals, so that nurses can really learn the skills that are specific to their type of nursing. So what happens is, as these nurses learn that skill, there's going to be more nurses able to provide that type of care. So for instance, let's say there are nurses who are going to be learning about dialysis. It would be of great benefit for those nurses to participate in high fidelity simulations with dialysis patients, simulators, where they're learning that training. And so the more nurses completing that training, the more care access opens, and the more you can create offices in more rural areas that don't have anything close, because you have more nurses who understand how to provide that specific type of care, that specific skill. And then high fidelity simulation will also improve quality of care, which I kind of touched on this, but with increased experience, you're going to have those increased critical thinking skills. So as I mentioned before, the more you're being exposed to something, the more you're going to have more confidence and more knowledge. And so then as you're seeing things over and over, you start to connect the dots. You start to realize why we do what we do, and start to understand how to put that lecture course, that simulation together. And then once you actually see it on a real person, that light bulb goes off and we're able to provide that care. And so as we have more critical thinking skills and we start to understand how medicine and nursing works, we understand the value in continued research and evidence-based care. And so we're able to increase our quality of care, provide better care with that experience, the critical thinking, and using the research. And so, when you're first starting out as a nurse, we're very task oriented, but the more comfortable we get, the more experience we get, we kind of step out of that novice role, and we start to understand the value in finding the most, efficient, evidence-based way to do something. And we start to understand and pick up on things we didn't when we were first starting in nursing. And so the quality of care is obviously going to increase with more experience. And the same thing when you're using those high fidelity simulations and you're repeatedly experiencing and practicing, you're going to then want to provide better care, and you're going to be able to provide better care. So there are some ethical and legal issues with implementing required high fidelity simulations, and not even with that implementation, but with high fidelity simulations in general. So one of the things that a lot of people can go through when completing a high fidelity simulation is some psychological distress. So oftentimes nursing students, a lot can be really young, and maybe they've never seen someone die. They've never seen someone be in so much distress. And so this inner stress develops, and they don't know what to do. Or maybe they have watched a family member die and they're doing an end of life simulation, and they're watching, the simulator who's having these terminal secretions, and they're restless and nothing's working. And all they can see is their loved one who passed on them. And that can cause a lot of psychological distress, a lot of emotions to come out. And so there is some ethical concerns with that there are some, in a way, a psychological harm that can occur. Another kind of positive ethical issue is that this does provide, realistic training before the care of real patients. So we're not just going to put someone out there with a patient who's never seen something before, never cared for someone, and we're going to say, okay, well, I want you to do this, this, and this. Is that really ethically right? Have they been appropriately trained? And so that's one of the things that makes this kind of more ethical, is we're giving that experience and that training. But something interesting is to think about, and there's not necessarily a right or wrong answer to this, but, as I talked about, the classroom setting of doing the high fidelity simulations, you're in a safe environment. So there really is no patient safety risk. It's okay if the patient died. It's a learning experience. But should there maybe be a punishment for mistakes in the classroom setting? So, there's two sides to this. No, it's a learning environment. Or yes, because if we're not punishing you now, will you understand the severity if you don't take this serious in the actual hospital setting? So it's just something to kind of think about. And then something else that kind of falls into this category is risk sensitization. So I found a very interesting article written by Analo and Reagan, and it was just talking about why sometimes too much high fidelity simulations can really cause students to, in a way, kind of become overconfident, because they kind of assume that everything's going to be really stressful. Because when we're thinking about a high fidelity simulation, most of the time when professors are utilizing that, it's going to be a mannequin simulator who is in distress, and we need to act fast because maybe they're in septic shock. maybe they're having a heart attack, they're having a stroke. And so students develop this idea that like, I have to just like do this, 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 and this. And they're not really taking the time to slow down. And so I really like this quote from the article. They said, reactivity can sensitize students to risk in a way that leaves them with a heightened state of awareness, which impedes their ability to take in the whole picture and process information. So this is what happened in the high fidelity simulation I mentioned earlier, where they really just wanted the students to focus on the fact that the patient did not have a DNRCC or advanced, directives filled out. But the students' reaction was, oh my gosh, they're coding. I need to do this, this, and this. And so the fear is, with too much of this, are we setting students up to become overconfident that you just have to, work really rapidly and not really slow down and assess the situation? And so obviously there are going to be types of nursing that are going to require a lot of reacting. There are types of nursing that are very high stress. There are types of nursing where patients are coding, multiple times a shift. And so obviously there is that, but that's not the case in every area of nursing. And so it's really important that we encourage nursing students to just slow down, see the bigger picture. And so we don't want them to think that everyone is critical in nature. It's important for students to see maybe that disease progression, that chronic illness, where maybe, at the start of your shift, you're noticing a couple things, but maybe you don't react to it right away. I want to see if the patient kind of normalizes and they got a low blood pressure. It's kind of random. Let's watch it. But if the idea of every simulation a student is completing in school is you got to react now, students are going to sometimes overreact. And so really what Onello and Reagan suggest is that you do a balance of high fidelity simulations that are proactive and reactive. That'll help students to see the bigger picture. So really this would go really well with those end of life situations where a patient's telling you they can't breathe and you're like, well, we need to get blood gases done. Well, no, we need to step back and remember that this is a DNRCC patient. So that just that thinking is really important. So I do have a couple of educational strategies that I did come up with for implementing the simulators. So as I kind of mentioned before, as far as the healthcare team goes, so this is already licensed and practicing nurses, physicians, techs, medical professionals. So what they can do is utilize the high fidelity simulators for yearly competency. Most hospitals, healthcare institutions do require that staff do complete yearly competency, and it's often specific to their type of nursing, their type of field. But what they can do is complete these yearly competencies as well as certification renewals. Like we mentioned, the PALS, you have your year, or every 2 years, your CPR, you have ACLS. There's different certification renewals, and maybe doing scenarios of high fidelity simulators that are based on those would be very helpful. And then you're also going to need to make sure that you have an education department at your healthcare institution of trained employees who can, run the simulator, first of all, but then also educate others on how to use the simulator. So educate the staff nurse on, you can come in here and practice. This is what you're going to have to do, that sort of thing. So as far as patients go, high fidelity simulations could be very valuable for patients. And what I'm kind of thinking with that is, having patients and families watching a simulation live. So, they're watching their physician and nurses and techs complete a simulation or a recorded one. That can really help them to better understand their diagnosis, their plan of care, and also participate in their care. So there's certain areas of healthcare where I'm thinking this could be really valuable. For instance, in the OB world, a lot of moms, especially first-time moms, might have a lot of fears about the actual laboring process. They may have a lot of fears about breastfeeding. And there are actual simulators that can have a baby. There's simulators that show how breastfeeding works, and there's actual simulator bras that a hospital can purchase and have, these moms to be come in and use those simulators and kind of learn that and practice it, so that kind of eliminates those fears. I'm also thinking this would be great for surgical patients to not necessarily watch a surgery, but to understand post-surgical care. So maybe there's a simulation they watch where, hey, the person did not keep that surgical site clean and we're in trouble and now they're in sepsis. I'm thinking maybe that little bit of fear can help people to follow, obviously, the discharge education that's provided. And there's also many others. Like, as a hospice nurse, I'm thinking having families see a simulation of end of life and understanding, those secretions, that restlessness, and maybe even a simulation of understanding what happens when someone is getting CPR and it's not going to work. That sort of thing could be really valuable. And then there's students. So this is where, like, obviously right now, that's where high fidelity simulators are really being used. So through students, as I've mentioned before in this presentation, the importance of using simulators throughout the schooling. So throughout their nursing school, and building off of each one, starting with that low fidelity and moving up to that high fidelity, and really helping students to learn in that safe environment, and then also develop those knowledge, critical thinking, physical skills that they need. And then something that I think could be really valuable would be having students kind of work in groups and create their own simulation as a team. So helping students to come up with, the different parts of the simulation, helping them to come up with the scripts that the family members in the room are going to use and stuff. I think this would really help them to develop those critical thinking skills when they're being forced to not only develop the scenario, but develop that, communication that's going on. So how are we going to evaluate that these high fidelity simulations are effective? So to do that, we are going to need to do a couple of different things. So the first thing is return demonstration. So what we would do in this case is we would have the students obviously, go through a simulation, maybe watch other students, and then they're going to complete it. Or it's just the simple idea that that's what simulations are. They learn the skills in the lab setting, and then they're going to go through and they're going to have this time where then they're going to, demonstrate what they learned. So the professor, the laboratory teacher, their fellow classmates are going to teach them the skill, and then they're going to do it in the simulation. We also can evaluate students as well as nursing and other healthcare professionals with pre and post Likert scales. Having them rate their knowledge and confidence level before and after completing the simulation can be valuable to understand whether it was really effective. Also, pre and post, questionnaires, whether they're, select A, B, C, or D, or they're open-ended. That can also show whether there was knowledge gained and if it was effective. It can also allow students to kind of share their thoughts on the simulation of things that they may have been afraid to tell others in the class or say in front of everyone. There also is the opportunity to use quizzes. So quizzes after the simulation can test whether the students really learned and picked up on the critical thinking aspects of the simulation. And it will help determine whether those who were watching, those who are the evaluating the simulation, and those who are just the observers, whether they were really paying attention. You can also use the high fidelity simulators for competency testing. I remember during my nursing schooling, we had 2 big competency tests during that we had to pass to continue in the program. And so it was a simulation scenario. It was high fidelity. The simulator could talk to us. They were having symptoms, and there was different things we had to do, and we had to use our critical thinking skills to figure out specifically the skills we needed to complete and the questions we needed to be asking the patient to get more information. You can also evaluate the effectiveness of a high fidelity simulation with post debriefing. So following the simulation, having students or healthcare professionals talk about what worked and what didn't work, and what we could do better next time. You can also get feedback during those debriefings. So whether that be your coworkers, if you're a healthcare professional, or classmates, if you're still in school. And so getting that feedback can also help the professor to kind of assess whether those watching were really involved in paying attention and see if they got something out of it, just based off of the feedback and questions they asked those who participated. And then there's also post question and answer sessions. And that's kind of what I'm thinking for our patients and families who complete these, asking them questions following it to assess their knowledge, and to also figure out what more do they want to know about. And then maybe we can develop a simulation to cover those things later. So obviously high fidelity simulators are expensive because of their technology and what all is required for them. They are a little costly. And so there are some financial implications that I wanted to go over. So the average cost of a high fidelity simulator is going to range from $10,000 to $100,000. Now the more advanced ones actually cost $250,000. So obviously, this is something that, not every hospital and, nursing school, med school can just purchase. So the great thing is there are a lot of grants. It just takes a simple Google search. There's also private donors. So maybe, there would be a nursing student, a nursing alum who would want to donate, and there's others as well. But something I think could be of great value is sharing simulation labs, simulators, that sort of thing among, different universities and institutions in the same area, as well as among various majors and professions. So what I'm thinking is, let's say that there's actually 3 universities or colleges, tech schools in the same area, in the same town. What if a contract was developed and all the 3 schools used the same sim lab? That means all 3 schools would be helping contribute to pay for the simulator. Also, you could do this among majors. So maybe you're out of a school that has, pre-med majors as well as nursing majors, and not even necessarily just pre-med, but I'm thinking, medical students, school students. And so a lot of times, a lab will be separate. So you'll have your nursing lab and then you'll have your med student lab. But what if we joined those, or we joined one room, and both schools, so the School of Nursing and the School of Medicine, were helping to pay for those simulators? That would kind of help, the cost when you have multiple contributing. And the same thing in the hospital setting. So a lot of teaching hospitals do have the simulators, but maybe it's only med students and residents utilizing them. What if we started, taking out of the nurses budget, the nursing budget as well, so that nurses can utilize it, and respiratory therapists, and even, nurses assistants, nurses aides, that sort of thing. And then there's also, if you have a hospital that has their own medical school and their own nursing school, you have 3 different entities that could use it. You have the nursing school, the med student school, and then you also have the healthcare professionals that are working there. And so, it might be a little easier to purchase. Another financial thing we do need to consider, though, is paying the wages of the trained staff, the employees, the professors, whoever's going to run the simulator, because it's something you have to learn, and understanding the technology behind it and how to work everything, and to get it to have these symptoms and to talk and everything. So we're going to have to pay that. So there is obviously some hurdles that will need crossed. But I do think that as more people see the value and obviously the better patient outcomes of the high fidelity simulations, why wouldn't we want to require it? And why wouldn't we want to help everyone get it? And so it could even come down to something where it's voted within the state legislature, who then will be able to make it a requirement and somehow provide federal grants, that sort of thing, and state grants. So in conclusion, I feel very strongly that high fidelity simulators and simulations are of great value. It gives us a chance as nursing students. It gives current nurses, it gives med students, current doctors, a chance to really hone in on skills and increase their confidence before they have to go and do it on a real patient. So high fidelity simulators and simulations are a great tool to promote that confidence, to promote that competency in the critical thinking. They're a great alternative when face-to-face patient care can't be achieved. Sometimes schools just don't have the resources to set everyone up at a clinical site, or something like COVID-19 happens and we lose that chance and that ability. And it's unfair to think then that our nurses were going to be prepared for the bedside. And so high fidelity simulations can give them the most realistic chance at being prepared. High fidelity simulators and simulations are a great learning tool for continued education and training among healthcare professionals. These allow for yearly competency training, allows for staff to really learn the specific skills for their unit that maybe they haven't done before, and to understand how to perform those skills with a confidence level because they've practiced. And lastly, high fidelity simulators and simulations are a great learning resource for patients and families to better understand procedures and disease processes. Patients and families can watch a live simulation, they can watch it on video, and you know what? They could even participate. And they could really have value in understanding how a disease is going to work. And then they might really, truly want to be more a part of their care. When they understand what's happening, they'll be more willing to be part of that care planning we do, and be more understanding on why we need to start understanding our actual diseases before it's too late, and why it's important to make decisions about our end of life care, about the things that are important to us, and to make our wants and our needs known before it's too late. So I just want to thank all of you for watching this with me and going through this presentation. I do hope that you learned something valuable and that you will encourage your nursing school, your place of work, your hospital, your healthcare institution to really consider high fidelity simulators and their value. Thank you.